Advanced Laboratory Services provides practitioners with a skin biopsy kit for evaluation of small fiber neuropathy. Open up the kit upon arrival to view the contents. Inside the styrofoam cooler you will find paperwork and instructions, including a test requisition form which must be filled out and signed. An ice pack, place this in the freezer. A bag containing Zamboni's fixative, rinse, and cryoprotectant. Place this in the refrigerator as well. A sterile punch biopsy kit. And a prepaid FedEx mailer for return shipment. The sterile punch biopsy kit includes a 3mm punch, the standard size biopsy for this procedure. The kit also includes forceps, scissors, iodine, alcohol swabs, 2x2 gauze, and a bandage. If you are performing more than one biopsy, we suggest having extra alcohol, gauze, and bandage material. In addition to the kit provided to you by Advanced Lab, please ensure you have an injectable local anesthetic such as 1 or 2% lidocaine with epinephrine, a syringe with 28 or 30 gauge needle, 1 cc tuberculin syringe works well, a sterile gauze pad, gloves, band-aids or bandage material, a tape measure, skin marker, and a sterile scalpel if desired. This video is for the skin biopsy procedure for intraepidural nerve fiber density analysis. There are 3 standard biopsy sites for cutaneous nerve evaluation. All 3 are located on the lateral leg and have well-established given normative values. Avoid sites of previous trauma, including surgery or prior biopsy. The proximal thigh site is located 10 centimeters distal to the great trochanter. Identify the site by drawing a circle or square around the area to be biopsied. The distal thigh site is located 10 centimeters proximal to the patella. Lastly, the distal leg site is 10 centimeters proximal to the lateral malleus. This is the area that is most commonly biopsied because of a large amount of supportive data. We have already discussed the biopsy procedure with the patient and confirmed that they have no allergies to lidocaine or epinephrine and discussed if they are on any blood thinners. Prepare the biopsy site with an alcohol swab to ensure sterile conditions. Keep in mind that we do not want to biopsy over marker or pen. Before beginning, inform patients that lidocaine can sting. Take your syringe containing lidocaine with epinephrine and inject it at an angle to ensure a skin surface will be anesthetized. Watch for a nice bleb to develop, which will be the biopsy site. Do not biopsy over the needle track from injecting lidocaine. Test for numbness by gently pricking an outside limit of the bleb to see if the patient can feel any pain. When performing the biopsy, use gentle but firm pressure while simultaneously rotating the biopsy tool back and forth. Do not stretch the skin using your other hand. Using a twisting or drilling motion with gentle pressure will ensure a flat and uniform biopsy. You do not need to advance the tool all the way. Usually 2/3 to 3/4 down is enough. Remove the punch tool. There are 2 ways to lift or excise the biopsy from the surrounding tissue. One way is using ultramatic forceps. Press down a bit on either side of the biopsy and then gently grab the deep dermis of cord skin and lift up. It's important to be careful to only handle the specimen by deep dermis. Do not pinch or handle the epidermis. The fine epidermal nerve fibers will be destroyed if they are crushed with the forceps. Once the sample is lifted from the surrounding tissue, Use scissors or a disposable scalpel to cut the tissue from the biopsy site. Immediately place the specimen into the Zamboni's fixative tube, labeled with the patient's name, date of birth, and biopsy site inside. Ensure the specimen is submerged before replacing the cap and invert the tube a few times. Check again to see that the specimen is submerged and fixative and not stuck to the cap. Apply pressure to the biopsy site to stop any bleeding. Apply a Band-Aid with folded gauze underneath to help prevent any possible leakage onto the patient's clothing. Patients should leave the biopsy site covered for 24 hours. Finish with written instructions on how the patient should care for the biopsy site. In the biopsy kit, you will receive several labeled tubes. Tube number 1 contains the Zamboni's fixative. Formalin is not an acceptable fixative and should never be used to fix specimens for epidermal nerve fiber density analysis. Tube number 2 is labeled phosphate buffer rinse, and tube number 3 is labeled cryoprotectant. The biopsy should be fixed in a refrigerator for a minimum of 8 hours and a maximum of 24 hours. In most cases, biopsies are fixed overnight and the rinse step is performed the next morning. After the fixation, the biopsy needs to be rinsed free of fixative and shipped to the lab in a cryoprotectant solution. This step will protect the sample from most shipping damage. The best way is to pour off the fixative into a small dish or bowl. This way, there is no danger of losing a biopsy down the drain. Pour off the Zamboni's fixative. Take the phosphate buffer rinse labeled number 2 and fill up the vial. Pour off the buffer rinse into the dish and repeat the rinse step. After the second rinse, we are going to fill the specimen vial to the top with the cryoprotectant solution. At this point, the specimen is ready to be shipped. It can also be stored in the refrigerator for up to 1 week or over the weekend for shipment on Monday. The important thing is that it is not left in the fixative for over 24 hours. Make sure that the skin has been submerged and the cap screwed on tightly. Before shipping, ensure all vials are properly labeled with biopsy site and side and patient's information. When packing a specimen for shipment, first place the frozen brick into the styrofoam cooler. Place the specimens inside the provided biohazard bag with the absorbent sheet and seal the bag. Paperwork should include a completed requisition form and patient insurance information. This can be folded and placed into the pouch located on the outside of the biohazard bag. Place the biohazard bag into the cooler. Close the cooler lid and slide it back into the cardboard shipper. Slide the box into the provided FedEx bag and seal the bag, which is ready for shipment. You should call FedEx in the morning to schedule a pickup at your location.